Hello, my name is Jenna Yager. I am a fellow at the University of Colorado. Today I'll be presenting on steady-state plasma tenofovir and emtricitabine among adolescent transgender men and transgender women receiving directly observed daily TDF-FTC. I have no conflicts of interest to disclose. Briefly, to provide a little bit of background, transgender persons are more vulnerable to HIV infection. Specifically, here in the U.S., the estimated prevalence among transgender persons is about 9%, compared to less than 0.5% in the general population. And even though we're aware of this increased vulnerability, transgender individuals tend to be underrepresented in oral PrEP trials, with transgender men having been excluded from these clinical trials, and transgender women typically being grouped with cisgender men who have sex with men. For example, in the IPREX trial, only about 14% of participants were transgender women, and in the Discover trial, only about 1 to 2% of participants were transgender women. One concern with having such limited data in this population is whether or not there's a drug-drug interaction that exists between hormone therapy and PrEP. Recently, a few pharmacokinetic studies have aimed to address whether or not this interaction exists. On the right-hand side here, you can see that some of these studies did find lower concentrations of either tenofovir or emtricitabine in plasma, and then others found no difference in concentration either in plasma or PBMC. So overall, the data does still remain limited in this population, especially among adolescent transgender individuals and transgender men. Therefore, the objective of this study, the TransPrEP study, is to assess whether the use of cross-sex hormone therapy altered the pharmacokinetics of tenofovir disoproxyl fumarate, or TDF, in combination with emtricitabine among adolescent transgender men and transgender women. So looking at the overall study design for the TransPrEP study, it was conducted among HIV uninfected transgender men and transgender women. They were adolescents aged 15 to 24 years, and they did have to be on a stable hormone dose for at least 1 month prior to enrollment, as well as being willing to maintain that same dose throughout the study period. The results of the TransPrEP study were then compared to historical cisgender controls from the CellPrEP study, which was a population of HIV uninfected adults aged 18 to 55. These studies were similarly designed. Both were prospective observational PK studies, where participants received daily TDF-FTC for about a month. Intensive PK sampling in both studies was performed under fasting conditions. In the TransPrEP study, this was done after about 2 to 3 weeks of daily TDF-FTC dosing, and in the CellPrEP study, this was done after about 30 days. For TransPrEP, dosing was directly observed, whereas in the CellPrEP study, adherence to daily TDF-FTC was assessed by other methods, such as pill count, self-report, and a dosing calendar. PK parameters were calculated using non-compartmental methods and log transformed. These results were then compared to cisgender controls from the CellPrEP study using a 2-sample t-test. So looking overall at the study populations for TransPrEP and CellPrEP studies, you can see that 47 TransPrEP participants were included in this analysis. 24 transgender women and 23 transgender men. In CellPrEP, there were 19 participants, 10 cisgender women and 9 cisgender men. Because TransPrEP was conducted among adolescents specifically, the age was younger in this group compared to CellPrEP participants. For creatinine clearance, this was calculated using Cockcroft-Gault for all participants in TransPrEP who are above the age of 18, as well as all CellPrEP participants. For those under the age of 18 in the TransPrEP study, their creatinine clearance was calculated using the Schwartz equation. And then looking at the route of administration for hormones in the TransPrEP study, 50% of transgender women were receiving oral or sublingual estradiol, and 50% were receiving intramuscular. Among transgender men, The majority were receiving testosterone intramuscularly, and the remaining 20% were receiving it via subcutaneous route. So now looking at plasma tenofovir concentrations among the TransPrEP population, here on the left, you'll see average plasma tenofovir concentrations at each of the sampling time points for transgender women in blue and transgender men in orange. And then on the right here, we're comparing the geometric mean values for these PK parameters among transgender women to transgender men. And you can see that overall plasma tenofovir PK was similar between these two groups. On the left, you can now see average plasma tenofovir concentrations at each sampling time point for cell prep participants in black. And then on the right, comparing transgender women to cell prep participants, you can see that transgender women had significantly higher trough concentrations. However, overall exposures to plasma tenofovir were the same between the two. And then if we compare transgender men to cell prep participants, you'll see that tenofovir AUC was higher among transgender men compared to cell prep participants. Here, this graph is showing us the individual AUC values for all participants. Transgender women are in blue, transgender men in orange, and cell prep participants in black. This gray shaded area in the background represents the range of median or geometric mean AUCs that were reported for comparator groups from previous PK studies among transgender women. Now looking at plasma emtricitabine PK, you can see in this graph on the left the average emtricitabine concentrations at each sampling time point for transgender women in blue and transgender men in orange. And then if we compare the PK in these two groups here in this table on the right, you'll see that transgender men had higher peak concentrations as well as higher emtricitabine AUC compared to transgender women. On the left here, you can now also see the average emtricitabine concentrations at each sampling point for cell prep participants in black. And then this table on the right is comparing the geometric mean PK parameters among transgender women to those cell prep participants. And you can see that overall, these two groups were pretty similar. If we then compare transgender men to cell prep participants, we again see that transgender men have higher peak concentrations and higher emtricitabine AUC compared to those cell prep participants. Similar to the graph that was shown previously for tenofovir, this graph shows individual plasma emtricitabine AUCs for each participant. We have transgender women in blue, transgender men in orange, and cell prep participants in black. And again, that shaded area in the background represents median or geometric mean AUCs of the comparator groups or control groups from previous PK studies that were conducted among transgender women. In conclusion, we did see adolescent transgender women had similar tenofovir and emtricitabine exposures compared to historical controls from the cell prep study. However, transgender men had higher emtricitabine exposures compared to transgender women and compared to cell prep participants. The mechanism for this isn't clear at this time. Overall, both tenofovir and emtricitabine exposures were similar to concentrations that have been seen in control groups of previous studies among transgender women. And based on this, daily TDF-FTC as PrEP should continue to be recommended for transgender adolescents who are at risk of HIV infection. I just wanted to thank the study participants, the members of the Colorado Antiviral Pharmacology Lab, the staff at both Stroger Hospital of Cook County and Children's Hospital of Colorado for their work on this project, and the National Institute of Mental Health for funding it.